So, good morning, everyone. Thanks for logging in today. I'm going to give you a little intro and about me to get started. So, I am Nicole Sales. I'm a recreation therapist and registered member of the British Columbia Therapeutic Recreation Association, also known as the BCTRA. I started my post-secondary education with a diploma in sports science before beginning and completing my bachelor's degree in therapeutic recreation. My support areas are physical rehabilitation and children and youth. So that just means that I took extra courses on those support areas. I have both volunteer and work experience with children in long-term care with seniors, older adults, and adults living with acquired brain injuries. I did my degree through Douglas College as well as my diploma. And when it came time to choose a degree, I wanted something that I could relate to, found interesting, and would ultimately be able to enjoy. Recreation has been a huge part of my life from childhood through to today. Growing up, I had four brothers, and I got to play a lot of sports with them while also learning about the sports they played. I played soccer and softball competitively, and I still continue to this day to play, but at a much more recreational level. I used to take dance lessons. I learned to play piano for a couple of years. And today, in my spare time, if I'm not playing softball or soccer, I enjoy getting outside for a hike or a walk, going to the gym to lift some weights, or just spending some time reading. I've learned a lot about myself through recreation, and I've been able to use it to cope during stressful times in life, let's say during exam periods or anything like that. So, let's get talking about recreation therapy. So, one of the first concepts that we focused on in our degree is the definition and meaning of the two words recreation and leisure. I'll give you the definitions here. So, recreation is a refreshment of strength and spirits after work, also a means of refreshment or diversion, so a hobby. Leisure is defined as freedom provided by the cessation of activities, especially time free from work or duties. So, that's the Webster's definition. We then spent some time in our courses discussing it as a group. Oh, sorry, I'm going to go back to that first slide there. Discussing it as a class. And we came up with other components that were also important in the definition. So, other things we discussed were the activities of enjoyment. So, one person may find something enjoyable while others may not. For example, someone might find gardening to be very therapeutic and a recreational activity that they enjoy, while someone else might not enjoy it at all. Um, Freedom of choice for activities, so knowing that individuals can choose their own activities and things that they enjoy. And then understanding that an activity may be scheduled or structured, but that doesn't take away from the recreational or leisure component or the therapeutic benefit of the activity. So then, after defining those words, we needed to discover what recreation therapy is. So this has been something that's been difficult to come up with a clear and concise definition as the profession is continuously evolving. It's gained a lot of momentum in the most recent years. On this slide here, I have put the definition that is provided on the BCTRA website. So that is that it enables persons to acquire and or maintain the skills, knowledge, and behaviors that will allow them to enjoy their leisure optimally, function independently with the least amount of assistance, and participate as fully as possible in society. So recreation therapy is a systematic process. It involves an assessment, and from there, a plan is created with goals involved. And then there's an implementation of that plan, and then a second evaluation of how the plan is going. Is there progress being made? Does there need to be changes made to the plan? And then this is just a continuous process that the plan can change, the implementation can change over time. Throughout the process of therapist involvement, the end goal is to have the individual participating in their recreation and leisure activities independently, as they would have received the tools necessary from their therapist and through practicing with their therapist to be able to participate without their therapist support. So on this next slide here, I have some pictures of adapted activities. So these are like the really cool, fun activities that we get to do as recreation therapists. So these could have been activities that these individuals enjoyed prior to an injury or a diagnosis, and now they are able to still continue participating with adaptations made. So in the top left there, you can see they're hiking, and it's an adapted wheelchair, so it allows them to go on tougher terrain. The picture beside that, you can see a lady with an adapted leg so that she can still continue to rock climb. We've got a sit to ski at the bottom there, and then we've got a lay down surfboard. So again, someone who may be using a wheelchair can still have access to surfing, which may have been a past leisure interest of theirs. So now we're going to talk about the domains of recreation therapy. So there are 5. We call them the specs. So it's the social, physical, emotional, cognitive, and spiritual health of individuals. So first, we'll kind of go over what those domains entail, and then I will cover how they can be improved through recreation. So your social health involves how you get along with other people, how other people view you, building and maintaining meaningful relationships, and how you react to various settings and situations. Your physical health is not just the absence of disease. Lifestyle and behavior choices that ensure health, so making good decisions for your health. Avoidance of preventable diseases, so that means doing things to take care of yourself and not allowing yourself to get ill due to poor choices. And then we've got the ADLs, activities of daily living, and the IADLs, which are the instrumental activities of daily living. I believe Gina, the occupational therapist, probably would have talked about these things, but I'll give a little review. So your ADLs are daily self-care activities. So that includes feeding yourself, bathing, dressing, and grooming. Whereas the IADLs are instrumental activities of daily living. They're not necessary for fundamental functioning, but allow us as an individual to live independently in a community. So this could involve money management, moving within a community, so using transit, preparing meals, or going shopping for groceries and necessities. A recreation therapist would work more on the IADLs than the ADLs. And then we've got our emotional domain. So this is a positive state of well-being. So being able to handle negative emotions and be okay with them. And of course, self-esteem and confidence. So how you feel about yourself and how you view yourself. And the ability to understand your emotions and regulate them depending on how you're feeling or what is going on at the moment. Your cognitive health, so that's your brain, is your ability to perform mental processes. So this includes learning new things, your intuition, judgment, language, and remembering or memory. And then the final domain is spiritual health. So this could be related to your religion, your faith, morals, values, and beliefs. So now we're going to talk a little bit more about the social domain and how recreation therapy works to benefit that. So human beings, we are social creatures, and by participating in recreation activities, whether it's in a small group or large, this allows for those social interactions to take place and fulfill that need. While working on improving one's social health, there can also be a positive impact on your emotional and cognitive health. So when you're making social connections and relationships through different activities that you participate in, these group activities are allowing you to have those interactions, and by increasing your social relationships, you reduce feelings of isolation or loneliness. And then our physical health here, oh, there was supposed to be a picture here, but depending on the physical activity that you are participating in, you could be improving your strength, your endurance, balance, or flexibility. So we all know that exercise is good for our health. So if you're going for a walk, or if there was a picture here of a group in a pool doing like a water aerobics class, you're doing all those physical things, but you're also making those social connections, which benefit your emotional and also your cognitive health. So exercising, it does allow for increased blood flow to the brain and those neural pathways to remain open and functioning. It is important as a recreation therapist that I am prepared to adapt activities for all individuals participating so everyone can reap the benefits of the session. So adaptations could include having a chair provided for rest periods or to establish more balance for individuals if they struggle with balance. I could also need to adapt the grip of, say, the weights so that someone can hold on to the weight and use it for the exercise class. For emotional, there are programs that we can do that specifically focus on emotional health. So a support group, journaling, or self-expression groups. But many of the other domains will improve emotional health as well. So like I mentioned before, when you're exercising, it releases those natural endorphins, which make you feel good, and which improves your emotional health as well. So as one improves in an activity or say a new skill, this can also impact their self-esteem and their confidence, which is part of your emotional health. And again, by participating in these group activities, you're going to reduce your seclusion and loneliness. And being able to experience your own emotions and understand them and feel okay with them is part of your emotional health, which we'll touch on a little bit with mindfulness later. And now for our cognitive health. So it really depends on the activity, but you can maintain and or improve through increasing physical activity, but also through using your cognition. So doing things like trivia or crosswords, those sorts of things stimulate your cognitive health. And we've heard the saying, if you don't use it, you lose it. So by stimulating your brain through these activities, you can improve and maintain your cognitive and motor functions. So you can see there's a lot of overlap between these different domains. Just because you're working on your cognitive health doesn't mean you're not working on your physical health, and vice versa. And then we've got our spiritual health here. So this is providing individuals with the opportunity to improve their spiritual health. This can be very important. There's also an opportunity for, again, connections to be made with a similar interest. So they've got something in common. And again, the socialization. So that, again, improves your emotional health. There is something called mindfulness, which can be used as a therapeutic technique. Mindfulness is a mental state that is achieved by focusing on one's awareness of the present moment. So being present in the moment and how you're feeling and what you're thinking, being okay with those thoughts and feelings and how your body feels. So just being very, very aware. This is something that we worked on towards the end of my degree, and is something that we are able to implement whether I'm working with children, seniors. It's something that all people would benefit from, and just being in the moment, especially with the way that society is. We're such a go, go, go society. It's nice to kind of sit down and just get in tune with your mind and your body. So I touched on this already, but there are the 5 domains: the social, physical, emotional, cognitive, and spiritual health of an individual. And we can be working on one while also improving on 2, 3, 4 of them at the same time. Despite the main goal being, say, your physical health, we would still be working on emotional and cognitive things. So now let's talk about the process of recreation therapy. This here is the leisure ability model. I became very familiar with it over the course of my degree. It kind of works in 3 phases, if you want to call them that. You can see at the bottom there, functional intervention. Beside that is leisure education, and then recreation participation. So functional intervention is the first step or phase, and it works on its way up to recreation participation. With functional intervention, you're going to have a lot of involvement from your therapist, teaching you new skills, kind of directing the sessions, and then eventually the goal, as I mentioned earlier, is to be able to participate independently in these different activities. So the first step when meeting a new client is the assessment. So this can take place in one session or over multiple sessions. There will be a combination of data collection from things such as medical background information and family members or other clinicians. A recreation therapist may choose to conduct observations in different settings to better understand the individual they'll be working with. The leisure interview will be a major component in collecting information on an individual. There will be questions on this interview It's really a conversation. They will pertain to past and current leisure experiences and wishes for future experiences. There's no physical component to the assessment. Um, from this assessment, there will be a list of strengths, limitations, and needs that is created. And based on each individual, a set of activities are selected. And if there's modifications required, the therapist can work with the individual on that. This will reduce the limitations and address the individual needs to meet realistic goals, which are set with the individual, by the individual, in collaboration with the therapist. So it's not just the therapist saying, these are the things you have to do and need to do. It's a collaborative effort. The individual is involved in suggesting things that they feel they need to work on or would like to work on. It's not strictly the therapist making those decisions. So I provided here just a list of some example questions that might appear on a leisure interview. So, do you like to try new things? This gives us an idea of how comfortable an individual is getting out of their comfort zone. How much support do they need to find new resources? What is something you enjoyed doing as a child? Do you still enjoy that now? So maybe someone used to play soccer, but as they went through life, they stopped playing. I'm a good example of that. I stopped playing soccer for 8 years, and I finally joined a new team, and I remember why I enjoyed soccer so much. But without the resources of having a friend on a team, I would not have been able to go out and find one. Do you prefer to do things alone or in a group? This gives us an idea of if someone is more introvert or extrovert, if they prefer to do things like reading on their own, or if they like to go out and be in a social group. Both types of recreation have their own benefits. It just gives the therapist a better idea so we're not putting people in situations where they're uncomfortable. What does recreation mean to you? What does leisure mean to you? So I provided those definitions earlier. The importance of this is to understand where someone's knowledge is of the words recreation and leisure, and if they could benefit from thinking about it a little bit differently. So people might just think of recreation as, oh, what you do in your free time, but they don't understand that there's things that you do just strictly for the benefit of enjoying your alone time or enjoying your free time. Choosing 3 words to describe yourself. So that would give a therapist insight into how someone views themselves and feels about themselves. So self-esteem and confidence are important things that we work on through our sessions. And what do you do in your free time? So some people might say nothing. They don't realize all the things that they do in their free time. Or some people might have lots of things that they do in their free time, but they're not enjoying them as much as they'd like to. So this gives us a better understanding of where people are at with their free time and what they would like to try or incorporate. I'm now going to kind of work through the process of functional intervention, leading through the other phases of the leisure ability model. So functional intervention, it's the first stage. It involves the highest level involvement from the therapist. So there will be a lot of teamwork. The therapist will be kind of directing these sessions, and the individual will be learning new skills. So this will address the prerequisite skills that are necessary for leisure involvement. So this could be where the adaptations are made to equipment and the individual learns how to use that equipment for the activity they want to participate in. So people who start sit to ski, they don't know how to use it right away. There's prerequisite skills like the core strength, the balance that need to be worked on before they can hop on the sit ski and ride it down the hill. So some examples here: social, the ability to manage your behavior appropriately in a social setting. So if you're in a group setting, you need to be able to interact appropriately with others, read the room, and be able to read the unwritten rules. So for example, if you're in a support group, it's probably not appropriate to be on your cell phone while someone's speaking. Physical, so this would be endurance, strength, hand-eye coordination, balance, and flexibility. So as I mentioned, if you were going to learn how to do the sit ski, there are physical skills you would require before you could actually carry out the activity. Emotional, so being able to manage your emotions, for example, anger, and expressing those emotions appropriately. So if something does frustrate or upset you, you're able to express that to others appropriately in a group setting without upsetting other people or changing the whole group dynamic and ultimately the session. So the major thing with cognition is the ability to understand and follow instruction. So these sessions again can flow as they were meant to. Leisure education is the second component. So this is where leisure education has 4 separate quadrants, you would call them. You can see them here: leisure awareness, leisure resources, leisure activity skills, and social interaction skills. So leisure awareness is the knowledge of leisure, so that definition, what it means to you, being aware of yourself, so how other people view you, how you view yourself, and the attitudes that you have towards leisure. So do you enjoy doing these things or not? And then being able to make decisions. Leisure resources is the opportunity to participate in activity, but also the ability to pull on these resources. So do you need to ask a family member for a ride somewhere? Or are you going to do your recreation activities at home? If it's at a community center, how do you get there? What's the cost? What days does it run? What times? And how do you register for these activities? Those are all things that your therapist would work through with you so that you have all the answers to the questions before starting into a program or a activity that you've maybe never tried before. Leisure activity skills, so traditional versus non-traditional. Your traditional skills would be things like your soccer game, your baseball game, your painting, the traditional skills. Non-traditional would be more things like going out and going grocery shopping, or maybe creating a support group, so being that leader and creating a group for others. Social interaction skills, so this is how you act in a small group versus a big group, or how you meet new people. Do you have the ability to build new relationships and maintain them, or differentiate between a healthy relationship and an unhealthy relationship? These are all things that your therapist would work on in the leisure education component. And then the goals would be set from the education component. So you would talk about what you know about recreation, what you know about leisure, and what you want to improve on. So I see that I, could work on my balance. So these 2 goals here, to demonstrate the ability to identify benefits of regular physical activity and to improve balance, those are your general and broad goals. The 2 bullets below each of them, those are called your objectives, and those are very specific and measurable. The reason they are measurable is so that we can see if there's progress being made, and if progress is being made, we can then modify the goals, or we can increase how much knowledge you want to have on these topics, or we can change the goals altogether because we've now reached this goal. What's the next goal we want to work on? So the objectives: to demonstrate the ability to identify 3 benefits to physical activity. If the individual can name those 3 benefits, then they've achieved that objective. If they are then able to demonstrate the ability to identify 3 benefits of physical activity specific to Parkinson's disease, they have now completed that goal. So that goal is done. We can set a new one. And the same for the improvement of balance. Those were just 2 examples that I came up with for the sake of this presentation. Oh, sorry. And then the final stage of the leisure ability model is recreation participation. So this is the ultimate goal. Ideally, all individuals would be able to seek out a new leisure activity and enroll in it, or however the process goes, and be able to participate in it independently without the support of their therapist. These can be structured activities, so maybe every Thursday you go bowling. That is still a recreational activity and something that the individual seeked out and is participating in. This is also, when you're participating in recreation, this is enjoyment for you. Hopefully you enjoy the things that you are doing, but it's an opportunity for self-expression. So you are able to express yourself through the activities you participate in. People can get an understanding of who you are by seeing the things you're interested in and the things that you partake in. So this was just a quick list that I've generated. really the limits are endless when it comes to recreation therapy. So we like to really think outside the box. We want to try new things. We want people to experience all the things that they want to experience. I just really covered the two recreation participation and leisure education components. So rec participation, we could be part of a walking club. So whether that's with a group of friends or it's a something out of the community center, if you're able to participate in something like that regularly, that shows that you have reached the end phase of the leisure ability model. Things like We Fit. So I got one for Christmas a few years ago, and that was something that my entire family played on. Little did I realize that it worked on things like balance, hand-eye coordination, and also it brought the family together. We were working on, our relationship that way. Chair exercise and chair yoga, so it doesn't mean necessarily you have to be sitting in the chair the whole time, but the chair can be used as a source of balance, or if you need to rest, you get lightheaded or your balance is off and you're not feeling confident, you can sit down, have a little break, and just adapt the exercises so that you're still able to participate. Arts and crafts, so that's things like painting, knitting, woodworking. I always think of painting, but those are activities that kind of cater to the more creative side. And again, same thing, you could be registered in a pottery class. And if you're able to participate in that without the support of your therapist, that shows that you have achieved the recreation participation component. Swimming, hiking, and bowling, those are 3 physical activities. Again, hiking would be something that's unstructured. You just kind of go for a hike. Bowling, you could be in a league every Tuesday or Thursday or whatever day of the week it is. Leisure education, this is where your therapist would work with you on exploring your resources. So this could be what's your support network, your family, your friends, co-workers, and with those support members, exploring resources. So are you guys going to do things in your community? Are you going to do things at the community center? And with those resources, you would need to be able to identify them and contact them so that you can get the information needed to participate and then ultimately utilize those resources. Leisure attitudes is important. So this is the way you think about leisure and recreation. And again, with the diagnosis of Parkinson's disease, your attitudes might change. You might not want to be out skydiving or something like that. You might want to focus on something like chair yoga or chair exercise to improve your balance or improve your gait, those kinds of things. So your attitudes might change. They change with age, they change with everything. Leisure education, appropriate attire. So this is something that your therapist would discuss with you before starting a new activity. So if you've never played baseball before, what are the things you need to show up with? Do you show up wearing sandals, or like what kind of footwear do you need? What kind of equipment do you need? Making sure that you're prepared for the activity before day one. So when you show up, you're not overwhelmed or don't feel like you aren't able to participate. And then looking at the norms of the group and expected behavior. So again, this is something you would like to discuss before starting into a new group. So what are some things that you can expect when meeting a new group? How do you read the room? Like, how do you know what is expected or unexpected of people? You can always ask the question, but sometimes we have to use our intuition. This is a couple resources for you. So the BCTRA, I am a registered member with them. That's where I found a definition of recreation therapy. The CTRA is the national, so the Canadian Therapeutic Recreation Association. Those are both great resources. I believe there's lots of links and information, so feel free to check those out, and you can definitely find out more information about rec therapy, what we do, what it looks like, and tons of different examples of activities we like to participate in. This is me and my contact information, so if you think of a question after today, please feel free to contact me. I know I talk really fast, and I probably did this whole time. So feel free to contact me. I would love to answer any questions and get in contact. And there's a picture of me hiking last summer to show you that I actually do go hiking, and I don't just say that I go hiking. And then that's my references there from the information that I provided today.